There are few things we're working on which I'm very excited about, always keeping in mind the potential this technology has to deliver medication to patients much quicker and at significantly reduced cost. One of the things that I'm really trying to make it happen is to create a center of excellence in manufacturing here in Massachusetts, by basically combining research and implementation of these new processes to the pharmaceutical industry. And we have done some analysis by looking that by applying this technology to the most prescribed generic drug here in the state of Massachusetts, we could save 45 million a year alone in the state of Massachusetts just on Medicaid by using this novel technique. That's something very exciting, and I'm trying to push this forward. Another second point is to try to use this technology to produce pharmaceutical for third world country, HIV medication. So basically develop and deploying those manufacturing processes in countries like Africa, where we can produce pharmaceutical at low cost and make it more affordable for many patients that actually need this. The type of company that we would like to collaborate and work on as we move forward, I would like to describe, at least right now, with these two major categories. Obviously, a large pharmaceutical company and generic company. And those because these companies has different reasons to apply continuous manufacturing. Generic companies, most because of their margin, low margin. Most of their costs, 50% of their cost versus sales is actual cost of manufacturing. So for them, it's a huge incentive to cut down cost of this pharmaceutical in this very competitive market. For the large pharmaceutical company, obviously, the margins are larger versus the generic industry, but there are other aspects that come into play. So speed to market, flexibility, being able to dial up, dial down your capacity of production for a specific pharmaceutical to respond more easily and faster to market change. And obviously making sure that those pharmaceuticals always has a very high quality. So each company looking at the application of this technology with the different interests. And those are the companies that we would like to plug in at this stage. There are, again, I would say there are three main challenges in order to make this technology applicable and commercially viable. One, as I mentioned, the biggest one is this industry inertia to make this change toward a novel manufacturing technique. Second one, as I mentioned, is the regulatory aspect, which, as I described before, is more, in my mind, of a perceived risk than actually a real risk, and the company really should try now to look forward and implement those processes rather than being concerned about the regulatory aspect. And the third, obviously, the technology as well need to mature. So we have a pilot process that we developed at MIT that we run for 10 days under steady state. Now the equipment need to be made more robust and brought to the next level such that they can implement commercially. That's most of the work that we are doing now in our facility here in Woburn. So Countinuus Pharmaceuticals has been founded 2 years ago, as I mentioned, as a spin-out, a licensed technology from MIT. In these last 2 years, obviously, we started as a most entrepreneur duo with some family and friends funds, and then we moved to angels financing. So we did a couple of rounds, a seed round through convertible note with angels, and we raised roughly $400,000 in seed money, which helped us to move on with the license with MIT and start talking with potential clients. We also realized that as we move forward, we had to build partnership. And mainly partnership on the equipment manufacturing space, because this technology is new, so we need the equipment manufacturing expert to take this to the next level, but also on the control and automation space, because important part of the continuous manufacturing is to have full automation and control. So we build partnership with EMA, Industria Macchine Automatiche, one of the largest equipment manufacturing for pharmaceutical, and with the Emerson, through a local business partner here, New England Control, to use their control system for our continuous manufacturing plant. So this now creates the full picture for us to be able now to work with the pharmaceutical company and start to develop continuous manufacturing processes for them. Thanks to the support from EMA, we actually avoid to do a Series A investment through an institutional venture capital firm. Actually, EMA invested themselves $2 million in our company. And so this really helped us to move on, setting up our lab, our operation now in Woburn, and being active on the work that we are doing. And so in the last 2 years right now, we have raised more than $2.5 million between angels, strategic partnership, and also grants. We have received a SBIR NSF Phase 1 grants, which we have already effectively executed and now submitted our Phase 2 application. And what we're working right now, it's really market validation. This July, we have closed our first contract which is, I think, is a very important validation with the large multinational pharmaceutical company. And we have several other deals now with the large and generic company which are actively negotiating. And that's what we're going to focus in the next year to close this deal and take Countinuus to the next inflection point.